thanks everyone. Premier, Minister Lecce took a lot of questions yesterday on around the plan and specifically around smaller class sizes, but I did want to get your thoughts on this as well, because this is easily one of the big concerns. We're getting feedback, especially from teachers and parents, reaching out saying that even with the caps, there's plenty of instances where those have exceeded. So my question to you is, was the possibility of smaller class sizes in elementary debated? Were you interested in asking if it was viable, doable? And if so, what put you over in saying they weren't necessary? Because depending on what enrollment is here at the TDSB, smaller classes aren't completely off the table. So what was your personal interest in that possibility?
Well, first of all, Lucas, I listened to you on the radio, and you made a great comparator to ourselves versus other provinces. We have the lowest cohorts in the entire country, of some of the lowest, smallest class sizes. We're putting approximately 500 nurses, a tune of $50 million. We're increasing spending by $309 million. On top of that, we're giving the boards $30 million additional dollars to hire more staff if needed. We're putting $50 million for cleaning, and then another $25 million for cleaning services as well. So we're pouring the money in there. But I'm the first to admit, Lucas, are we going to face a challenge? I'm sure we're going to face a challenge. But did we get the best medical advice we could ever get from some of the smartest minds in the country? Yes, we did. And talking about one of the smartest medical minds in the country, I'm going to hand this over to Dr. Yaffe. Thank you.
Thank you, Premier. I think we all know that it's ideal to have physical distancing of 2 meters between people, unless you're in the social bubble, and otherwise to wear a mask. And that is generally what's being recommended and being done. In the younger grades, the evidence so far from jurisdictions across the world in our experience with COVID-19 is that children under 10 years of age, first of all, don't tend to get infected as much. If they do, they are very mild, or in fact, they're often asymptomatic, and they don't tend to spread it to other people. So, and of course, it's more difficult for them to wear a mask. But of course, it's optional, and we would encourage, if the parents are able and the children are able, for the children to wear a mask as well, and to maintain as much distance as possible. Of course, washing hands, all the other things, don't go to work or school if you're sick, all those things are important. Everything contributes to maintaining health, and we'll have to see how it goes and monitor how we can improve things as we go along.
Follow up?
Thank you. Fair enough. And actually, Dr. Yaffe, I'd appreciate it if you could take this next one. If you could expand a bit more on the conditions that would cause a cohort to go home, get tested, and isolate. You mentioned yesterday, if there's evidence of a case, even a suspected case in a school, all the contacts of that case, be it a child or teacher, would be tested. But let's say a student or even staff, they get tested and they're positive. In that case, is the whole cohort getting tested and staying home too? If you could just give a few scenarios of what exactly would constitute, we've got to send everybody home.
Interesting you asked that, because I know that our staff at the Ministry of Health have worked very closely with the Ministry of Education on scenarios such as you described, so that schools will be able to understand what could happen if there is a case, because there's a lot of concern and anxiety. I do want to go back for a minute and say that, public health has worked with schools locally for many years. It's one of the common things that public health units do, working with schools when there's a case of measles, there's a case of tuberculosis, other things. So it wouldn't be the beginning of a relationship. It's building on a past relationship. COVID, of course, is, can be a serious infection. It's causing a lot of concern. It's a pandemic. So that's why we're going the extra mile. First of all, again, we're educating and hoping that parents will take this seriously and screen the kids before they go to school for any symptoms. And if they have symptoms, don't send them to school. If they go to school and they develop symptoms while at school, then the teachers and the staff will be trained on how to isolate the child quickly, notify their caregiver if it's a young child. Possibly test them if there's consent and if there's ability. or send them for testing with the parent. If we have one case in a classroom and the classroom is cohorted, we're looking at the people in the classroom. Whoever this child or teenager has been around we're talking about within 2 meters for over 15 minutes is the usual thing for contact follow-up. So to be safe, we take the whole classroom, including the teacher, the staff, and get them tested. And so one of the important things is having quick, reliable access to testing and getting testing done quickly and getting results. And if they were close contacts, the household, close friends, people they were around a lot, we would be asking them to stay at home, possibly the whole class, depending how close the class is. If we have 2 cases in the same class, it's the same as with one case. But if we start to have cases in separate classes, the first question will be, are they linked to each other? They might be friends. They might be siblings in different grades. And trying to investigate, do we think they actually infected each other somewhere outside of the school? In which case, the fact they're in different classes may not be as relevant. But if we find they actually infected each other at school somehow, then we're looking at 2 classrooms and following them up. It would be extremely rare, in consultation with public health, that a whole school would need to be closed. I remember my experience in SARS and in the H1N1 flu back in 2009-10. At the beginning, there was some panic, and school principals wanted to close schools. Almost never will this be required. Obviously, there could be circumstances if it's widespread, but I want to reassure people we will take every potential case very seriously, investigate them, make sure that contacts are identified, and isolated, and tested, so that we can make sure people stay as healthy as possible.